Well, welcome back, Scouts, for Activity 17, Pets and Dinosaur Activities and more First Aid. Hemphill, Camino Real, Blanco Vista Elementary, and all others are welcome.
For more fun activities at home, visit our YouTube channel, Sacred Springs Scout Reach. Please join me in the Scout Oath. On my honor, I will do my best to do my duty to God and my country and to obey the Scout law, to help other people at all times, to keep myself physically strong, mentally awake, and morally straight. Please join me in the Scout law. A Scout is trustworthy, loyal, helpful, friendly, courteous, kind, obedient, cheerful, thrifty, brave, clean, and reverent. A Scout is kind. A Scout knows there is strength in being gentle. He treats others as he wants to be treated. Without good reason, he does not harm or kill any living thing. A Scout is kind.
Show the Cub Scout sign. Tell what it means. Make the sign with your right hand. Hold your arm straight up. The two raised fingers stand for the Scout Oath and the Scout Law. The fingers look like the sharp ears of the wolf, ready to listen to a Kayla. Remember that a Kayla means good leader to a Cub Scout. Your mother or father or guardian is a Kayla. So is your Cub Master or your den leader. At school, your teacher is a Kayla.
Say the Cub Scout motto. Tell what it means. The Cub Scout motto is do your best. A motto is a guiding principle and a rule for living. Do your best means trying your hardest, not just a little bit. Do your best all the time. Do your best in school and at home. Do your best when you play a game and help your team. Do your best as you work on your rank adventures.
Well, good afternoon. Welcome. My name is Dr. Carla Cunningham, and I'm a veterinarian, and we are in Metropolis, Illinois, with Miss Aggie here. And we are going to give Aggie an exam, like would happen if you took your dog or cat to a veterinary practice. And what I mostly take care of now are dogs and cats. I used to take care of cows and horses and pigs, but now I mostly just take care of dogs and cats. And this is little Miss Aggie here, and we're going to give her a good exam today, okay? Now what we're going to start out with for Miss Aggie is a heartworm test. Heartworms are a disease that is spread by mosquitoes, and it's really important for your dog especially to be on heartworm prevention. And when they go to the vet every year, we recommend that they get a heartworm test. So we are going to draw a little bit of blood from Miss Aggie right here. It's a very little needle. She did not flinch. You were very brave, Miss Aggie. Scouts are brave, and Miss Aggie was brave, so maybe she could be a scout, huh? So we're going to take this blood, and I'm going to put it in this little vial right here, and this is called conjugate, and this is what we're going to use to determine if there's heartworms in here. So we're going to put 4 drops, 1, 2, 3, 4 drops of blood, or of conjugate, and 3 drops of blood. 1, 2, 3. Okay, and we'll put it in this little vial, and we're going to mix it up. And then I'm going to place it in this special test kit, and then I'm going to place it in this reader, and it's going to get started in just a minute. And we're gonna watch that as this goes on. But while that's running, I'm gonna go back over here to Miss Aggie, and part of my exam is I'm going to start with her face, and I'm going to look at her teeth, and she's got beautiful teeth. I'm checking for any tartar, things that would cause cavities in you, or broken teeth, and hers look perfect. So we want to make sure that you're brushing your teeth twice a day because the Scout is clean, and her teeth are clean, so she must be chewing some dental chews to keep her teeth nice and clean. So the next part of my exam is I'm going to take this instrument. It's called an otoscope. Right now I don't have the cone on. I'm just going to use it to look in her eyes to make sure they're bright and shiny and clear, and they are. And then I'm going to take this cone and put it on there, and we're going to look in her ears. And I bet your doctor does this to you when you go to the doctor. And I'm looking in her ears for any signs of infection or pain, and hers look perfect, so that's good. Now I'm going to take a stethoscope, and a stethoscope is something that we use to listen to sounds inside of something. And so the most common thing that we use a stethoscope for is to listen to their heart, but I can also use it to listen to their lungs. So right now I'm listening to her heart, and I'm going to use my watch to count how many beats she has per minute. And her sounds really good and strong. I'm going to use it to listen to her lungs. Good girl. And now I'm going to use it back here and listen to her belly. See if there's any, you know how your stomach growls sometimes? That's normal. We're just listening for those sounds, and her sounds completely normal. What a good girl, Aggie. Okay, so I'm going to hang up my stethoscope. So now I'm going to feel her body. You know how when you go to the doctor, he wants to feel your belly, make sure everything feels okay? That's what I'm doing. And I'm also feeling her legs, feeling her lymph nodes, making sure everything feels nice and healthy, and it does. So, I have found Aggie to be perfectly healthy today. We are going to give her one vaccine. We're not going to give her a vaccine with the needle. She already got a vaccine, or she already got a blood draw with the needle. So I'm going to give her a vaccine of something called canine respiratory disease. And this is going to protect her from getting things called kennel cough or bordetella when she goes out and plays with her other dog friends. So this has got a special little container or little device on the end. We're going to put that in her nose and stick it in her nose. And she says, "Oh, well, that was okay." She took that pretty well. And she was such a good girl for her exam that we're going to give her a treat. What do you think? You think you should get a treat? Huh? Okay, easy. Good girl. All right. Well, thank you for joining me today for an exam for Miss Aggie, her veterinary checkup. And you guys have a great day, and we'll see you down the scouting road.
Requirement 1. Care for a pet for 2 weeks. Make a list of tasks that you did to take care of the pet. If you do not have a pet, research one that you would like to have and write about the care it needs. Does your cat open cans of food when it's hungry? Does your dog take itself for a walk? Of course not. Unlike people, pets can't take care of themselves. They need someone to take care of them. Every kind of pet needs a clean, dry place to sleep, except for fish, of course. A dog might have a special place in your home where it sleeps. A horse might live in a barn or out in a pasture. A hamster lives in a cage. A cat will make its own bed in a sunny spot by a window. Nutritious food, clean water, and plenty of exercise help keep pets healthy. Just like you, your pet will get sick if it eats nothing but junk food and never gets any exercise. Your veterinarian can suggest the right food and exercise for your pet. Speaking of your veterinarian, most pets need regular checkups. Your veterinarian can help you make sure your pet stays healthy. He or she can also give your pet vaccinations to prevent serious diseases. Your vet can even clean your pet's teeth. For this requirement, take care of a pet for 2 weeks. Write down the things you did. If you do research on an animal you would like, record your notes on a separate page. Requirement 2. Learn more about your pet or a pet you'd like to have. List 3 interesting facts that you learned about your pet. Pets have amazing stories. Did you know that cats can see 6 times better than humans at night? Did you know that dogs can vary in size from 2 pounds, a Chihuahua, to more than 150 pounds, a Great Dane? Did you know that hamsters bathe themselves like cats? Did you know that horses produce 10 gallons of sweat a day? See what you can learn about your pet by reading a book or exploring the internet with your parents' or guardian's permission, and write down what you learned on this page. Requirement 4. Do your best to train a pet to perform a trick or follow a simple command, and explain how you trained it. If your pet is a hermit crab, fish, snake, or the like, you may skip this requirement. Many pets, especially dogs, can learn tricks like sitting, rolling over, and talking or barking on command. A good way to teach a trick is to give the pet a treat each time it does the right thing. Offer plenty of praise, too, and be patient. Find out what tricks your type of pet can learn and pick one trick. Try to teach your pet that trick and explain how you taught it. You can also teach your pet to be courteous to others they may meet. For example, a courteous pet will know what it means when you say no or will come when called. Just like the Bear Scouts, pets need to learn to be courteous and friendly. Requirement 5. Tell 3 ways that animals can help people. There are many ways pets can help people. Search and rescue crews use dogs to find people who are missing. Guide dogs help blind people get around on their own. Therapy pets help people who are sad or who are dealing with a lot of stress, like kids in the hospital. There are even dogs that can call for help if someone is having a medical emergency. How have you seen animals at work? Can you think of other ways animals might help people? Requirement 6. Tell what is meant by an animal being rabid. Name some animals that could have rabies. Explain what you should do if you're near an animal that might be rabid. Just like people, animals can get sick, and sometimes they make other animals and people sick too. Rabies is a disease animals get when a dangerous virus affects their brains. Rabid animals that have rabies, act strangely. They might walk in an odd manner, seem excited or afraid, drool a lot, or do things that are unusual. For example, a bat with rabies might stay on the ground instead of being up in trees. Rabies is rare, but any mammal can get rabies. Wild animals such as raccoons, skunks, foxes, and bats are more likely to get rabies than pets. That's because dogs, cats, and horses usually get vaccines to prevent rabies. However, don't assume that an animal is safe just because it is someone's pet. Pets that are allowed to roam outdoors can get bitten by wild animals that have rabies and may be infected if they have not been vaccinated. If you see an animal acting strangely, or if you get bitten or scratched by an animal, even your own pet, Tell an adult right away. Remember that Scouts always look to safety first.
Requirement 3. Make a fossil cast. Fossils are the remains or impressions of prehistoric organisms or living things preserved in the earth or rock. Examples of fossils include skeletons, leaf prints, or footprints embedded in the Earth's crust. Fossils and historical artifacts can be found anywhere. The only known Tyrannosaurus rex tracks in the world were discovered at Philmont Scout Ranch, the first in 1983 and the second in 2009. Philmont is located in the Rocky Mountains near Cimarron, New Mexico. You might have a chance to see it in person if you take a backpacking trip to Philmont when you become a Boy Scout or a venturer. Some fossils, like the T-Rex footprint at Philmont Scout Ranch, formed when a dinosaur stepped into soft ground and left a print. While the ground hardened, a fossil formed. Today you have the chance to make your own fossil. Instead of soft ground, you will use air-dried clay. Roll your clay into a ball in your hand. Pat it down on a paper plate to flatten it out to at least 1/2 inch thick. It is okay if it looks a little bit lumpy. The ground is lumpy too. Press a leaf, toy, dinosaur, plastic bug, spider, or another object into the clay. You can even use sticks and rocks to form a dinosaur foot. Carefully remove the object. The impression, the dent left behind by your object, is just like the impression left behind by dinosaurs. Follow the instructions on the package to let your clay harden. Share the fossil cast you made with your den or family.
Requirement 4. Make a dinosaur dig. Paleontologists dig through layers of the ground to carefully uncover bones, rocks, leaf fossils, and other objects that were left behind when the dinosaurs died. Today, you are going to make your own dino dig. Carefully follow the instructions of your den leader. Materials for each scout: disposable aluminum pan, plaster of Paris, safety glasses, dust mask, various objects, toy dinosaurs, polished rocks, silk leaves, etc. Safety: be sure to give adults lots of space while they get the mix ready. Adults should wear safety glasses and a mask to keep from breathing in the dust. Instructions: 1. Have an adult mix plaster of Paris. 2. Have an adult help you pour enough plaster of Paris to cover the bottom of each pan. Place a few objects in the bottom layer. 3. Have an adult help you pour another layer and place more objects. 4. Repeat until the pan is full. 5. Set the pan aside to dry until the next den meeting. Requirement 6. Be a paleontologist and dig through the dinosaur digs made by your den. Show and explain the ways a paleontologist works carefully during a dig. It's time to have a dinosaur dig. Paleontologists use many different types of tools to dig out bones and fossils because they do not want to damage anything. They usually use small tools like chisels and paintbrushes. You will be digging through plaster instead of rock, so you can use a large nail, a small hammer, and paintbrushes to dig out your objects. Be careful when you work so you can get the dinosaurs out in one piece. Safety. For your safety, wear a mask and safety glasses while you work, just in case any plaster pieces or dust go flying through the air. Can you imagine how exciting it must be for a scientist to uncover bones that are millions of years old? Share with your den leader how your dinosaur dig went and what you found. Tick bites. Ticks are small, hard-shelled arachnids that bury their heads in your skin. Protect yourself whenever you're in thick infested woodlands and fields by wearing long pants and a long-sleeve shirt. Button your collar and tuck your pant legs into your socks. Inspect yourself daily, especially the warm and hairy parts of your body, and immediately remove any ticks you find. If a tick has attached itself, ask an adult to help you. The adult will grasp the tick with tweezers close to the skin and gently pull until it comes loose. It's important not to squeeze, twist, or jerk the tick, which could leave its mouth parts in the skin. Wash the wound with soap and water and apply antibiotic ointment. After dealing with a tick, thoroughly wash your hands. If you develop a rash or flu-like symptoms or otherwise feel ill in the next days or weeks after being bitten, talk to your doctor. Bee and wasp stings. Scrape away a bee or wasp stinger with the edge of a card, such as your whittling chip card, or ask an adult to help. Another method is to put a piece of tape on top of the sting to pull out the stinger. Don't try to squeeze it out. That will force more venom into the skin from the sac attached to the stinger. An ice pack might reduce pain and swelling, and some people have severe allergies to bee and wasp stings. If someone has trouble breathing after being stung or feels his or her throat swelling or closing up, seek medical help immediately and alert an adult. And find out if the person is carrying a kit for treating anaphylactic shock and help him or her administer the medication. Chigger bites. Chiggers are almost invisible. Their bites cause itching and small welts. Try not to scratch chigger bites. You might find some relief by covering chigger bites with calamine lotion or hydrocortisone cream. Spider bites. Only a few types of spider bites cause serious reactions. Victims of these spider bites should be treated for shock and seen by a doctor as soon as possible. When possible, try to identify the spider or take the dead spider to the physician office. Be sure that you don't put yourself in danger to do so. The bite of a female black widow spider can cause redness and sharp pain at the wound site. The victim might suffer sweating, nausea, vomiting, stomach pain and cramps, severe muscle pain and spasms and shock. Breathing might become difficult. The bite of a brown recluse spider doesn't always hurt right away, but within 2 to 8 hours there can be pain, redness, and swelling at the wound. An open sore is likely to develop. The victim might suffer fever, chills, nausea, vomiting, joint pain, and a faint rash. Snake bite. Snakes are common in many parts of the country, but bites from them are rare. Snakes try to avoid humans and normally strike only when they sense danger. Snake bites seldom result in death. Use a hiking stick to poke around stones and brush ahead of you when you walk through areas where snakes are common. Remember to stay on the trails. Watch where you put your hands as you collect firewood or climb over rocks and logs. The bite of a non-venomous snake causes only minor puncture wounds. You can treat these like other puncture wounds. Just wash with soap and water and then apply antibiotic ointment and an adhesive bandage. Before applying medicine, put on disposable non-latex gloves. Ask about any drug allergies and get permission. Get medical attention if you see signs of an infection.
The bite of a venomous snake can cause sharp, burning pain. The area around the bite might swell and become discolored. If you think a person has been bitten by a venomous snake, call for help and follow these steps. Keep the person calm and still. Do not let the victim walk unless it is unavoidable. For example, if you have to evacuate the area, if possible, have an adult carry the victim to a safe area or to medical help. Immobilize the part of the body that was bitten and position it below the level of the heart. Remove any rings or jewelry from the bitten extremities. Clean the wound with antiseptic and cover it with a clean bandage. Don't apply ice or a tourniquet. Don't cut the wound or try to suck out the venom. Don't give the victim caffeine or alcohol. Try to remember the snake's shape and color pattern so you can describe it later, but don't try to capture it. Nosebleed. A nosebleed can look bad, but it will usually stop in just a few minutes. Have the victim sit up and lean forward to prevent blood from draining into the throat. Pinch the nostrils together for 10 minutes to maintain pressure on the flow and stop the bleeding. Apply a cool, wet cloth to the victim's nose and face above where you are pinching. As always, wear latex-free disposable gloves. Watch for symptoms of shock and treat if needed. Call for help if the bleeding doesn't stop after 15 minutes. Frostbite. Frostbite happens when the skin gets cold enough to freeze. A sure sign of frostbite is grayish-white patches on the skin. Some victims will complain that their ears, nose, fingers, or feet feel painful and then numb. Others won't notice anything. If you suspect frostbite, get the person into a tent or building, then gently warm the affected areas and keep it warm. If an ear or cheek is frozen, remove your glove and warm the injury with the palm of your hand. Slip a frostbitten hand under your clothing and tuck it beneath an armpit. Treat frozen toes by putting the victim's bare feet against the warm skin of another person. Avoid rubbing frostbitten flesh. That can damage tissue and skin. You can also warm frozen parts by holding it in warm, not hot, running water. Have the patient exercise injured fingers and toes, and don't let the injured area freeze again. Get the victim to a doctor. What's the best way to avoid frostbite? Stay warm and dry. Wear warm gloves, socks, and a hat. Wool and synthetic material will keep you warm when they get wet. Cotton won't. Dress in layers so you can regulate your body temperature by adding or removing articles of clothing.
Requirement 6. Put together a simple home first aid kit. Explain what you included and how to use each item correctly. Every home and car should have a first aid kit so that supplies will be there when you need them. Home first aid kit. Here are the things you should include. Tweezers, box of latex-free adhesive bandages, different sizes, 12 each of 3 by 3 inch and 4 by 4 inch sterile pads, roll of 1 inch and a roll of 2 inch latex-free adhesive tape, scissors, safety pins, 2 1-inch roller bandages, 2 2-inch roller bandages, 3 cravat or triangular bandages, 2 17-inch splints of thin board, antibiotic ointment, calamine lotion, latex-free disposable gloves, mouth barrier device, goggles, hand sanitizer. Your car first aid kit all the items listed above, plus a small flashlight and spare batteries, white handkerchief to attach to the car so you can attract attention if the car is disabled, a blanket, large red and white sign that reads "Send Help," placed in the front or rear window in an emergency. Personal first aid kit. You should also make a first aid kit to carry on outings. Include these items: adhesive bandages, moleskin, antibiotic ointment, latex-free gloves. In addition to the basic items above, consider including gauze pads, adhesive tape, soap, scissors, mouth barrier, pencil and paper, and antiseptic wipes. Requirement 7. Create and practice an emergency readiness plan for your home or den meeting place. Emergencies can happen at any time, even in the middle of the night. What would you do if you woke up and smelled smoke or heard your smoke alarm going off? It's important to have a plan. Sketch a floor plan of your house or apartment. Figure out 2 possible escape routes from each room and draw them on the floor plan. Now decide on a place away from the building where everyone can meet once they are outside. Discuss your plan with your family and practice what you would do in an emergency. Discuss these questions with your parent. Are our smoke alarms working? Are our windows easy to open? How could we get out through windows, such as a picture windows, that don't open? Are there rooms on a second floor or higher? Should we buy escape ladders? Does our building have a fire escape? Would anyone in the family need special assistance in an emergency? Requirement 8. Visit with a first responder. First responders are people who keep us safe. They include police officers, firefighters, EMS workers, and search and rescue professionals. Whenever an emergency happens or someone calls for help, they are the first people to respond. Many first responders were once Webelos Scouts just like you. Some enjoyed learning about first aid and wanted to provide emergency medical care for a living. Others became police officers or firefighters because they wanted to help other people, just like the Scout Oath says. In fact, first responders are helpful all the time, even when they aren't working. If an emergency happens in the woods, on an airplane, or in a restaurant, they quickly take action. Meet with the first responder and learn more about his or her work. If possible, meet at a place like a fire station or police station so you can see the equipment and vehicles the first responder uses. Ask the first responder what training or education he or she has had. Find out how you can be helpful in your role as a Scout first responder. A Scout is courteous. When you visit a first responder, show good manners, follow instructions, and say thank you as you leave. Maybe someday I'll be an EMT like my mom, but I can help my community even if I don't become a first responder because I know what to do in an emergency. In fact, Mom said people usually look to Scouts in emergencies because we have special training. I think I'm up to the task. What about you?
Join us next time for Activity 18, Ways to Communicate and Home Fix-It Project. If you are interested